So thank you for being here today. We are going to discuss about health system. In my first part, I have Aydin Halidi, the health minister from the Ministry of Health, Varda Chulako, officer for health statistics from Agency of Statistics. In the other party, I have Artur Bayrami, representative of World Bank for Kosovo, and Ban Beyrani, advisor of the director of University Clinical Center of Kosovo. So I would like immediately to start with a question addressed to Arvinde, to the health minister. So can you give a brief overview for health insurance in Kosovo and who actually use it?
Yes, we have a newly drafted law that has been approved but is not yet being implemented. What basically the law says is that every citizen is entitled to basic healthcare services. It covers every citizen, and by basic healthcare services we mean the emergency services and other basic medical needs for every citizen of Kosovo, whether they work or do not work. This also includes all children and children of those that are under the age of 18, independent of their income status and everything else. Besides this, the law also includes other premium services that can be offered through different types of private health insurance companies. Everyone is entitled to choose if they want to pay a special premium to a private health insurance company to get additional health coverage and for health services that they may need. Besides this, the law also states that everyone that is a citizen of Kosovo has the right to choose if they want to pay for additional services from private health insurance companies, but this also is valid for all non-residents of Kosovo.
So this law is to be
Yeah, it is expected to be implemented during the coming year.
Thank you. So Varda, how much is spent for Kosovo in health, and if there is a raise in spending, which is the way to control it?
Well, from this table of Kosovo health system of university clinic services, we can see that based on the allocation and the expenditures, we have our total use budget is 83,500,073,000. We can see that it was 97% of our budget was spent. But the way how to control it, first I would like to say some of the basic characteristics of Kosovo health system, which is interested in financing of health financing, under investment in health, poor health infrastructure, best management of health resources, low compensation of health workers. It also came to the point when there was a decrease in moral health and an increase in informal payments such as corruption, and many others, and this all came as a result. Because we're still a post-war developing country, and the allocation of funds is not being right because our budget is from taxes, and the allocation of funds is not being equal to everyone because we are seeking from different ministries. I want this much and I want this much. But if we would use health insurance funds, it would be much easier to control, as there would be much more transparency. We would know how much it would be spent for this part, how much for that part, and this is the best way that we could control the growth of health spending.
Thank you. Arjun, as we know, Kosovo is one of the places that is considered with low health spending, and most of the officials from these countries, meaning Kosovo and other countries too, offer two main arguments. The first one is level of economic development does not allow for higher allocation of funds for healthcare. This allows the assumption that health funds could increase with economic growth. And the second one is there exists a trade-off between social spending and economic growth. So what do you think about this?
Well, in regards to the first statement, we could also rephrase the sentence by saying that that level of economic development determines the allocation of funds for healthcare. And consequently, economic growth will also mean a higher increase in GDP, higher level of taxations in nominal value, and consequently will also yield to a higher budget for spending on healthcare as well. And this would be, in a way, through taxes as well as through the health insurance fund. Although the government with tax-based systems are frequently criticized for spending too little on health, it is important to know that this is a collective decision, since it is being made through Parliament, and consequently it is done through the decision by the people. Whereas the way through the health insurance fund would be through market, behavioral and other political events which cannot be guaranteed to yield the level of spending that is desired. And in regards to the second point, the existence trade-off between social spending and economic growth. I think that numerous studies have shown that social spending is positively linked to economic growth in a sample of developing countries, whereas negatively related sample of developed countries. And from this we can infer that social spending is instrumental in economic growth in poorer countries, as well as it has a higher impact to that.
Okay, thank you. So one is, we know out-of-pocket payments are very present in Kosovo. Mainly for what types of services are applied or used, and what is their impact on low-income households' well-being? Moreover, is there any international organization that provide medical devices?
Well, a large proportion of total healthcare spending in Kosovo, nearly 40%, occurs outside of the budget in the form of out-of-pocket payments by private individuals. Let's define the audience out-of-pocket payments. Those are the payments or direct payments made by individuals that are not reimbursed by a government or insurance. And much of this amount is most likely spent on services like purchases of drugs and supplies, and on private health facilities and abroad, on hospitals outside of the country. As for your question about the impact on low-income households' well-being, the out-of-pocket payments have a negative impact on those with a low income. The highest impact is seen by pushing people deeper into poverty, or those that are above poverty or just at the poverty line, pushing them into poverty. Households spend approximately the same amount on healthcare across the income distribution. However, the poor are the most partially hit in terms of share of the overall consumption because of these payments. Some studies show that the expenses for healthcare at the lowest income group represent 13% of total consumption in comparison to only 4% for the highest income group here in Kosovo. In Kosovo, state plays the role of the purchaser and the provider at the same time. The highest share of out-of-pocket payments in Kosovo goes to pharmaceutical products and private sector healthcare. Then who internationally helps us? Besides state budget and direct payments, a small amount of revenues in Kosovo come from international aid. Organizations such as the World Health Organization, the World Bank, International Labour Organization are effectively engaged in enhancing human and capital capacities in Kosovo, which we are really thankful for. They are engaged in helping Kosovo's government.
Thank you. So, Barbara, you can answer this question. Is healthcare system right? Meaning that some pay for taxes when they actually do it. So they pay taxes, but maybe they cannot use it.
Yeah, well, I do believe that the way the healthcare system in Kosovo is financed, namely through the tax-based system, is right. And I consider that to be that this gives access to healthcare everyone that is not constrained by income or health status. In addition, an equal contribution means the creation of very large risk pools, and this spreads the risk across the whole population of the people who pay taxes. In addition, another advantage to this system is the way that the tax collection is made. It is more advantageous because we can collect all various taxes such as VAT, consumption, income, and other forms of taxes, like custom duties, excise taxes, whereas for health insurance it is rather more difficult. And resources for health increase over time as the economy grows, and the financing system that the government owns and operates these facilities, and hence it has a lower cost of operation. And in addition, it is worthwhile to highlight the fact that tax-based systems can potentially capture revenues that the health insurance is more difficult to do.
Yes, but in general, do you think that it is right or not? For example, they pay taxes for medical care and healthcare, but they actually cannot use it.
Well, even if they cannot use it, a tax-based system mobilizes funds from everyone, regardless of their health status, income, or occupation. Even if they don't use it, they have it right there. And when they need it,
The primary objective of this one is equitable access to
unlike health
population.
insurance.
So, what do you have any consent agreement for those? I mean, it is right.
Yes, in this, the way that the health care system is set up right now and the way that it's financed in taxes is just for those really basic needs and not to, just to be able to provide at least for everyone, just for those basic needs that everyone needs to have. But on the other hand, yes, we can state easily that doing so with private healthcare companies and other medical insurance companies would be better, because those who would be able to and those who would choose not to take the risk of having to pay much more in the future for an additional premium could have a much better coverage in the future. So yes, it would be much better if people would choose to do so and cover themselves with private insurance companies.
Another question. When who is insurance offered and does everyone has equal access to it? And moreover, do citizens really have to buy health insurance, or if they cannot afford to buy health insurance, what should they actually do?
The healthcare insurance in Kosovo, according to the law that I mentioned before, is basically provided in two ways: through private companies that would offer these private insurances, which would be an optional package for everyone to buy, Kosovo residents as well as non-Kosovo residents. And there's the one that is the mandatory healthcare insurance, which is provided by the government. Basically, we charge a tax to the employee and the employer percentage, and that is taken, and the fund is fund basically from that income. And then it's the risk. What the government basically tries to do is pool that risk and then distribute it to those who really need it. And regarding to the previous question as well, I think that everyone in a point in their time will actually use the healthcare, whether it be public or private, and will come down to basically using these types of services. So in the long run, I think everyone would be able to benefit from the healthcare system.
And everyone has equal access to it. Those people who cannot afford it, they can be exempt from it, so they can use the other funds to pay for them to provide the basic health services, so everyone can afford and they can use the health system.
Well, actually, it's not an equal use in health insurance, because at the moment that health insurance companies are presented in a country, there is competitiveness between the companies, so not everyone has an equal right to use.
They have the basic health services. Everyone has equal access to it, then you can decide whether you want an extra health insurance for a specific health insurance for you or not. You can only use them.
Yeah, but we have in Kosovo nearly 40% of unemployment. Most of the people cannot afford that.
And if they pass the status and a means one, they can
Yes,
be
but
exempt from it.
what
So
the law aims to do is to provide the very basics. What we would aim to cover are, for example, if someone, even no matter how poor or unemployed he or she might be, the law guarantees for that person is, for example, if he or she gets hit by a car and is sent to an emergency room, he or she will be treated and will get the basic health treatment that that person would need, regardless of their income status, if he or she is employed or unemployed, or whether it has additional healthcare service.
Yeah, but that is tax based. The way that is financed is through tax based,
Yes.
not
But-
through health insurance.
through health insurance, it would be much better because as Pai Kotu, which is Director of Information Department of Ministry of Health, he stated that if we would start implementing the health insurance funds, that we would have a budget for health, we would have twice the budget for health services. So that would be much better because we would start implementing, we would start having new resources and new infrastructure, and everything would be much better because the health system would go well.
Besides this, in the future, as the economy grows, what we could do is basically offer more support towards the private insurance companies, and basically orientate the general opinion to go for those extra premiums and maybe just join the private insurance companies as well, because as we know, then this would actually somehow alleviate the government spending, and we could also get additional revenues from the taxes that we would get from the private insurance companies. So this is also can be seen as an option in the long run, which the government and the public sector would both benefit from.
But why in the long run? I mean, health insurance fundings has shown that they decrease economic development in In such cases, national savings levels would also decrease and low in capital investment. If those are decreased, that means that in long run employment would decrease.
Well, this is why we, with the other ministries, would seek for different instruments to support economic growth in the future. As we know from the National Economic Reform Program, it has been approved and that will be implemented in the upcoming years. It aims to increase the foreign investments in Kosovo, so that would compensate as well for maybe the potential losses that we could have, and then proceed with more economic growth in the future.
Thank you. Can we go with, because we are running out of time, with the other questions? So, then most of the people have to pay actually for their education, and many treatments are under-received after long waiting periods. However, few people can afford to seek private treatment. So based on your position as health minister, how would you solve these problems and how would you plan to reform the system?
Yes, this is one of the key points that we are basically trying to address by the law clearly states that we aim to cover everyone. Those basic needs, those basic everything that is basic and elementary should be available and accessible to everyone. The health system in Kosovo definitely needs reforms. We know that corruption in clinical institutions and in healthcare institutions is pretty high. We have to talk with the clinical center of Kosovo and other hospitals in Kosovo, maybe do something to actually address the corruption and make the doctors actually do what they're supposed to do. And because as we know, oftentimes the patients get asked to go to their private clinic because apparently there's no instruments in there or something similar. What we should first do is basically supply all the hospitals with all the necessary materials that they need to have to do their job, and then address to the doctors and solve the problem with corruption and make them work what they're supposed
Do
to
you
work.
think that this system, if it will be implemented, will be a better situation for
It is,
all
def-
the
it is definitely a step forward, but I'm not saying it's perfect, but it could be a step forward
It would be a
towards improving the current situation that we have with the health sector.
so how about you know how the healthcare system is actually financed, but I would like to hear how should be financed in the near future and is there any international impact?
How it should be financed is from the law that it was in 2014, in April 2014, which is not still, it hasn't been implemented yet, but we are waiting to implement. And I think the best way is the healthcare system should be financed from health insurance funds, which are specific groups of population such as employees, employers, self-employed that contribute a specific fund, and the government covers the rest of the cost. And thus the government decided to buy a specific health insurance for the insured people. And if those specific person they want to buy any extra additional insurance, they can buy a specific insurance provided by different insurance companies. And with the implementation of health insurance funds, it will increase financial stability of health sector, and at the same time, it would ease financial sector burden when used by vulnerable groups. And this would increase job security as it lowers employer incentive for laying off, and for those people who have a poor health status. And it is in line with World Health Organization with another assembly which was held in May 2005 when it was required to incorporate a method for prepayment of financial contributions. Therefore, the best way would be to have to implement health insurance funds. And yes, we have several international aid and also several donors. I will mention the last case which happened 9 days ago when the United Emirates they decided to donate us a hospital for pediatric hospital in worth of $20 million.
So one is, also corruption is also part of the healthcare system, and first it may have negative effects on low-income families because it pushes people to more poverty. The second one is that these payments are made directly to healthcare workers, so they do not directly improve the health system. And the third one, these payments are not recorded, thus taxes are not collected, which would be used to improve actual public services such as healthcare system itself. So people that are not able to pay income, like the difference between low people that pay and those people that have more, how they are treated.
Well, as corruption is a phenomenon which is present worldwide, I can say that Czechia through years has been able to eliminate this problem. There is no corruption in public health care. This is just it's not possible. As I said earlier, it's out-of-pocket payment for those who are and are causing damage right now to low-income households, and only because of health insurance companies, because people think that they should get better treatment because they have money. But this won't happen in Chicago. Taxes are collected regularly for the benefit and improvement of health system. I can say that all patients, those with low income and those with higher income in Chicago, are treated with the same attention as tax-based systems is all about equity. And taxes, all of them contribute the same on the health system, and none of them has more rights than the other, no matter if they have a work status or any other thing. Since payment in tax-based system is mandatory, the system of Chicago avoids many problems that are common to voluntary insurance markets.
So, do you have anything to add about the corruption or not? So, do you have any comments about Chicago as their anti-corruption or not?
There, as he
Out of
is an
public
official,
corruption.
as he is an official of the Chicago,
It's not about-
it's quite obvious that he will not admit that there is corruption in Chicago. Everyone knows that there is corruption in Chicago. We
Do you
need
have
to,
any cases? I
we-
mean, I can personally and be responsible for that.
you'll find your file at the courtroom, don't worry about it. There is corruption in Chicago, we all know it. It is one of the necessary reforms that we have to do in order for a better healthcare system. It is one of the things that we will address in the future as well, and we will just make a better solution and provide a better healthcare system.
But actually, introducing health insurance funding could result in worsening of health indicators, at least initially, because due to possible resistance from health providers and existing corruptions. This is
So there is corruption.
So there is
health
corruption.
insurance.
Not in the healthcare sector.
So now you're mentioning corruption in the for healthcare companies, which I don't quite understand because they
No,
are not quite.
Corruption, but not in the healthcare sector. Other sectors.
Okay.
So, do you have anything else to add before we go to the question?
So thank you.
Okay, so is there any question about this?
I have a question for the minister. You were expected to start implementing the health insurance from the beginning of 2015. What happened?
Yes, this is slightly delayed because we slightly delayed. A couple of years in government terms are not too much. Let's get this straight first.
the people are there.
Yeah.
They can do it.
Well, it's you're doing the treatment well, so if you didn't what are you gonna say? There is a slight delay because we were not able. The government that was prior to us, they kind of miscalculated some of the spending that would be required in order to implement this law. So we are waiting until we actually pool all the necessary funds to start implementing it. It is slightly delayed, but it will be implemented
Or
in the upcoming
maybe you
years.
don't have the administrative capacity to introduce the health insurance.
That's why we are working on it. It is slightly delayed to be implemented the way that it's supposed to be,
Because
not just leave it halfway there.
based on the work of President Christine and all of the developing countries' governments lack the necessary administrative capacity, and it's really not sure if health insurance funding will be implemented in Kosovo any soon.
It will be worth waiting.
That's why we are working as hard as possible to get it done. And one thing that we have to
If
add,
it wasn't
there might be losses in the short term that the government would actually face. But the one thing that we have to note is that the government is here for the citizens. We might face losses, but those are acceptable losses if we don't for the general well-being of our citizens.
But are we ready for those losses because we are a poor country? I mean, if it didn't work in many developing countries that are much richer than Kosovo, what makes you think that it's going to work?
That's why strategies are different. We will do different strategies and do a better targeting through the law.
future of the healthcare when I see the way how the minister communicates with the director of the
They should be on the
university
same side.
clinic, because these two are supposed to jointly deliver the healthcare. So are this animosity simply because you are from LDK and he is from PDK, or what is the rationale behind this confrontation?
Dear citizen, the, the main point of this confrontation is that the government, for quite a long time, has been trying to reduce the corruption that has been going, especially in the clinical center of Kosovo. And one of the things that that we kind of hate the most is that they are not being cooperative with us. And they continue to deny, as he did in front of us today, that there is no corruption, while everyone knows we have countless cases of corruption that are being reported by the citizens. But the day will come that they will have to face with everything that they did, and hopefully, hopefully,
This confrontation is.
the cops are waiting outside for you. And hopefully the healthcare system will be reformed and work the way that it's supposed to be working.
Well, the confrontation is that we do not need decrease of economic development. We are a young country, we need that. We need national savings, and health insurance fundings are shown to decrease economic development.
Okay, and can I ask you a question? You work for the clinical center. I'm assuming you are a doctor, or you have to do something very closely with the medicine. When you swore, where you swore, you swear to protect, to provide for everyone, no matter of the race and income and everything. How can you set the economic growth and the money in front of the well-being of your own citizens?
Well, because if you don't have economic growth, we will have less well-being in the future.
But we're not doing that, so, because being a tax-based system, we're foregoing inefficiencies in order to have equality among all citizens.
You can all work together for a
Yeah.
health
Yeah.
insurance fund.
Yes.
So is there any other questions?
Professors.
Professor?
Okay, so thank you so much.